Hi, I'm Dr. Lydia Sosenko, dental practitioner and educator of dental sleep medicine, oral appliance therapy for the relief of snoring and apnea. So today I'm going to be answering the question, why does my device not work like it used to? So I'm going to be making a few assumptions today. I will be making the assumptions that you have been diagnosed and have been working with dental practitioners trained and educated in dental sleep medicine and with medical professionals, and that you've, prior to treatment, have had some kind of symptoms. It could be snoring, it could be poor sleep quality or excessive daytime sleepiness, along with your apnea events, and that when you say it was working, that the symptoms were reversed, stopped, eliminated, and the apnea events were eliminated, and either through follow-up visits were confirmed or through sleep testing. So why do symptoms come back? And usually there's some common reasons for it. It could be that your device has been compromised. It could be either too loose, or it's not maintaining your jaw where it needs to be kept. It might be broken somewhere. There might be a strap that is just too loose now that might need to be replaced, or the position that was confirmed to work is no longer being maintained, or have been kind of self-reversed in some way, or inadvertently had been moved or changed. So the device might have been changed. Another possible reason would be weight gain. Sometimes it just takes 3 to 4 pounds of increased weight gain to make a difference in your airway anatomy, and the current position might not, where it was working, might not be enough anymore. So you might want to look and see if your weight has changed from when the device was working. Thirdly, if your weight has been maintained, just with age, things change. The tissue changes not only externally, but internally, and it is normal to have to tweak your device a little bit with age. And what I mean by tweaked, it means to have your jaw advanced a little bit more. So that is also common. Or there might be other medical issues, possibly allergies, medication. There's other medical diseases that could cause an increase in soft tissue masses, which can contribute to an increase of snoring or apnea symptoms and an increase in airway diameter. So with that, that's also a possibility. So what to do? So if you've ruled out all other medical issues of severity, and you have been working with a dentist through this process, or physician, and you're kind of on the maintenance level, if the symptoms are there and returned, go ahead and try to advance your device. If you and again, it's always best to contact your medical dental provider that helped you with this prior to doing any of this. But usually for my patients, I would say go ahead and advance further if you remember how. If you don't remember how, my resource page will have a link to several different types of devices to kind of help you remember how to advance your device. Never advance it to the point of discomfort that does not get improved, or it takes too long for your bite to get back to normal in the morning, or ear pain, or any kind of unusual pain in your head and neck area. You might even want to reverse it back. So be careful with that. Secondly, definitely, if you cannot advance it because the device has limitation, if your device can't move any forward, you might be at the maximum that it was allowed to move, or that its capability. That definitely means you need to go back to your dental sleep medicine provider, and usually with the help with the dental laboratory, they might be able to reset your device. If it's too old, they might need to replace it, but sometimes there's things that can definitely be done with the help with a dental medicine provider. Thirdly, you might want to use some kind of an additional therapy, or alternate with either CPAP if you are able to use your CPAP. Some people, if they're not sleeping on their back, they're maintaining that the device is working, so you might want to add some kind of positional therapy. And also to consider possibly, if it is nasal type snoring, certain nasal dilator things out there, similar to Breathe Right strips or intake, and I will have a link to some of those resources. If it's nasal type snoring, the device will never reach points above the throat area. So if it's a nasal type snoring, some people can add one of these nasal dilation products in addition to wearing the oral device for improved success. So those are a few things. But definitely I would recommend getting in touch with your dental sleep medicine provider so that they can help you troubleshoot and see what next needs to happen to help you resolve where you're at. So if you have any other further questions that I can answer, feel free to email them to me or contact me through social media, and I will try to answer them the best that I can. And until next time, thank you so much.